Well, unquestionably, the biggest relationship we have right now is with the creation of Optum Labs. Mayo Clinic is the founding medical partner of that, along with Optum, and now we're inviting other high-quality academic practices, research universities, policymakers, pharma, and payers, everyone to come together. And we are working the details out of that in that space, and we've launched a series of test cases to see, will this work, to understand what are the practice drivers of better outcomes. So we're looking at surgeries and medical practice and hospital practice to see what determines safer care and better outcomes. We have 149 million lives over 2 decades, 149 million lives of claims data over 2 decades. From Optum, Mayo's putting in 5 million lives of clinical outcome data, and others are joining that group in Cambridge. So that's the main one. We have others, other relationships such as that, but we are basically harnessing big data to determine what costs, what investments, what activities are we doing that drive better care at lower costs. It's going to be a game changer. I really do believe that. That's why the Optum relationship is so important, because you really need to know what people spend over years, not just during a short window of time when they came in for an operation or for a test. So, to be candid, the majority of those are outcomes but not cost. And that's why the Optum thing is going to be so helpful to us. What we'd like to create with that is that ultimately a system-wide, profession-wide, transparent database, so we can look and see who provides the safest, best procedure, let's say knee replacement, hip replacement, or diagnosis and treatment of breast cancer, or whatever. What are their outcomes and what are the costs? And if they're doing it better than we are, well, heck, how can we learn from the U or from Fairview or whoever it is? How do we make this go forward?